In part B of chapter 8, we're picking up with the manus or the hand for the other 19 bones that are found in the arm. 5 of those are the metacarpals. So if you notice with the metacarpals, they start with the thumb as 1, 2, 3, 4, and then finally the pinky would be metacarpal number 5. So 5 metacarpals forming the palm of the hand. You have 14 phalanges. So if you notice, all except the thumb, you have a proximal digit, a middle digit, and then a distal digit. So again, starting with the thumb, Roman numeral 1. With the thumb, you only have the distal and the proximal digit to it. So 14 bones altogether forming the fingers. The thumb is also known as the pollex. And the fingers, of course, we mentioned, have the proximal, middle, and distal phalanxes. With the pelvic girdle and the lower limb, you have 4 major bones forming the pelvic girdle. So 2 hip bones are joined together, again, with the fibrocartilage that's called the pubic symphysis. So it's this area where the 2 bones, the right and the left pubic bones, join together. They were once called the os coxae or innominate bones, but now we just simply refer to them as hip bones. You also have 2 other bones that are part of the vertebral column. The first one is the sacrum, and the second one is the coccyx. So you have the sacrum, 5 fused bones there, and then of course the coccyx or the tailbone. With the pelvic inlet and outlet, of course, this creates an area for the birth canal, and women, of course, have a broader, wider pelvic set of bones, and also the birth canal is by natural design, allowing the woman to actually deliver the child by natural childbirth. With the hip bone itself, there are 3 different portions to it. So you have an area called the iliac crest. You have an area where the head of the femur fits into it called the acetabulum. Some people say acetabulum to try to spell it correctly, but acetabulum. And then you have this area where a bunch of nerve vessels and blood goes through called the obturator foramen. Remember, foramens are large openings or holes in bones so that blood vessels, nerves can pass through the bony matrix. There's a couple of different portions to the hip bone. So notice with your chart you have the orangish color, which would be the ilium. You have the green color, which would be the ischium, and then you have the pink color, which would be the pubis area. So notice it's the ilium that houses both the iliac crest and you have the iliac fossa. This is also where your sciatic nerve goes through that area, so you have the greater sciatic notch. The pubic bone itself is the anterior portion of the hip bone. So you have this front portion or anterior portion, and then the ischium is the one that bears most of the weight from the torso of the body, then directly bearing on the hip bone. This would be the ischium, or the green portion here. So again, it's very important to take the structure of the skeleton itself, take the bones separately, look at them, hold them, feel, touch, and pick out all the different portions, the different features of the bone itself. Comparing male and female, we've already said the male by design is allowed to attach the stronger, larger muscles to. Females have the wider, more shallow pelvic area, and again, it's so that she can gestate that child for 40 weeks of gestation in humans, and also allow for the birth canal to open up to allow the head and the shoulders of the fetus to be delivered naturally from the opening of the cervix. The lower limb itself also has 30 bones. Remember, the arm had 30 bones. The lower limb also has 30 bones. And it's by design there to allow the weight of the torso of the body that's delivered to the hips to now be transferred to the lower extremities or the legs. And the other major function, of course, for the lower limb is for locomotion or walking. 4 different regions. You have the femoral region, in association with the bone there, which is the femur. We've already mentioned that the lower portion of the leg is the crural region. Then, of course, the ankle is considered to be the tarsal region, and then the foot itself is called the pedal region. If you're looking at the femur, it is the longest and the strongest bone in the body. So the longest, strongest, bearing most of the body weight, all the body weight that the hip bones actually have are directly transferred onto the femur. It has a almost circular or hemispherical head to it. It has a major neck region, and then you have two projections on the proximal portion of it. Remember, you have proximal and you have distal further away. You have the greater trochanter, and then you have this area called the lesser trochanter. On the posterior side of it, you have something called the linea aspera, and then on the distal end, you have condyles and epicondyles. So the condyles are more distal. Directly above it would be the lateral epicondyles. On the medial side of it, you would have the medial condyle, and then of course above it would be the medial epicondyle. So remember that the hemispherical head is designed to fit in the huge opening or fossa within the hip bone called the acetabulum. And of course this is where the ball and socket joint, the ball head of the femur, fits into the socket or acetabulum of the pelvic bone. You have an area called the fovea capitis, which is a pit on the head of the femur. Ligaments attach within this area, and then we already mentioned you have both a greater and a lesser trochanter where muscles can attach to the femur. We mentioned the linea aspera is the ridge on the posterior side of the shaft of the bone. We mentioned you had lateral and medial condyles and epicondyles, so please pay particular attention to, are you talking about the lateral side or the medial side of the bone? And then of course the condyles are lower, and superior to those would be the epicondyles. Then you have, of course, have the area on the anterior surface where you have the patella that fits in that area. So you have the patellar surface. On the back side, we said the back part behind the knee is the popliteal area, so you have the popliteal surface. The patella itself is a sesamoid bone. So remember, as a sesamoid bone, it developed in the tendon where you would have major stresses, and the knee is one of the major joints in the body that bears quite a bit of stress. So by the time you're age 3, 4, 5 years of age, it starts to ossify from cartilage and become the patella or kneecap. The tibia and fibula form the lower leg. So the larger of the two bones that actually bears the weight from the femur and delivers it to the ankle would be the tibia. So notice on the distal end of the femur, you have the large bone which carries the body weight to the lower leg is the tibia. So notice, you can notice in your notes that it's the major weight-bearing bone of the crural region. It does have medial and lateral condyles, so you have both medial and lateral condyles to it. There's something called the tibial tuberosity, where the quadriceps muscles from the femoral portion of the leg attaches to the tibia. And you have something called the medial malleosus. So this is the knob-like projection, of course, on the medial side of the tibia. So that would actually form what most people feel as their ankle bone. It's actually the medial malleosus of the tibia. The fibula is actually not a major weight-bearing bone. A lot of anatomists consider it to be just spare bone tissue. It does have a head to it. It does have an apex region, and it has something called the lateral malleosus. So the medial malleosus is on the tibia, the lateral malleosus on the fibula. So it's considered to be a stabilizer for your ankle joint. So it acts like a strut or a stabilizer for the ankle formation and to support what's going on with the tibia as far as the tibia carrying the body weight allowing that body weight then to be delivered directly to the talus in the foot. The tibia and fibula, since it's very close in association like the radius and the ulna was in the upper arm, the tibia and fibula also have the interosseous membrane, so that the crural portion of the lower leg